All right. Next up, members, is another Chair Gomez bill. This one is House File 2591. Chair Gomez, would you like to move that House File 2591 be laid over for possible inclusion in the 2025 taxes bill?
Yes, please, Chair Norris.
All right. Chair Gomez, to your bill.
Thank you very much. So House File 2591 is the Support Medicaid Not Millionaires Act. And, so what we have a situation with our federal government where we've seen a House budget resolution passed some weeks ago. And it has a negative $880 billion target for energy and commerce and a positive $4.5 trillion target for the Ways and Means Committee. Now, it's interesting to me that you will hear Republicans at all levels of government talk about their concern with the national debt. And that is a justification, in some cases, for the kind of destructive, draconian measures that we see at the federal level that is, resulting in material impacts here in Minnesota. There are almost 200 employees at the Minnesota Department of Health who are losing their jobs. We have no infectious disease control staff, for example, at MDH. That's just one example across the government. And the justification, again, that we hear is, well, we have this ballooning national debt. But what we actually see when you look at the budget resolution that was passed by the U.S. House of Representatives is that this $880 billion cut in energy and commerce, that can only really come from Medicaid. The $4.5 trillion positive target in Ways and Means is going to extend the Trump tax cuts, which disproportionately benefited the biggest corporations in the world and multimillionaires and billionaires. And so Medicaid impacts every one of your districts, every one of our districts. 42% of children in Minnesota rely on Medicaid for their health insurance. Half of long-term care is paid not by Medicare, but by Medicaid. 2/3 of people on Medicaid are families, parents, people about to have babies, children. 20% of mental health treatment. We're in the middle, right, of a substance use disorder crisis. Half of SUD treatment in Minnesota is paid for by Medicaid. This program is a lifeline for Minnesotans. And what we see is that there's a proposal at the federal level to cut this life-saving program in order to give more tax cuts, not to address the national debt, but to give trillions of dollars of tax cuts to corporations and multimillionaires. And so what this bill does is, in the case, this $880 billion cut, our portion of it, Minnesota's portion of it, would be 1.4 to 1.6 billion in fiscal year 2027 is what our analysts think, right? That's in 1 year. That blows a giant hole in the side of our budget. And it's very likely that whatever the budget deal is ultimately passed is ultimately passed by Congress will happen while we are not in session. And so we could be looking at having this giant hole blown in the side of our budget so that we can hand tax cuts to corporations and millionaires while we're not even here to respond to it. And so what House File 2591 does is it establishes a fifth tier on the individual income tax at a rate sufficient to offset any cuts in federal Medicaid funding that flow to the state of Minnesota. The rate applies to, the threshold is 1.667 million for married filing joint returns, $1 million for single returns, and 1.3 million roughly for head of household returns. If we have been sold this lie before, right? About we've heard it certainly in the 80s, right? When I was a kid, we heard it again in 2017. Oh, if we just give these tax cuts to corporations and millionaires and billionaires, it's going to flow down. It's going to trickle down to regular working people. Well, look at any analysis of the 2017 federal TCJA. And every analysis that I've read says that those benefits disproportionately went to top income earners, to big corporations. The promises that were made. There were promises made to our communities in 2017. This would raise wages, this would create jobs, this would create investment in our communities. None of that has happened. What the TCJA did is it cut tax bills for very rich people. It allowed corporations to do stock buybacks. It allowed them to pad their executive compensation. And none of those benefits, as every time they tell us that if we just cut taxes for the rich, it'll flow down to working class people, did not materialize. And so what this says, what House File 2591 says is, look, if the unelected billionaires who are running the federal government want to give themselves and their buddies huge tax cuts on the back of Minnesota kids and people in long-term care and elders and families who rely on this health care, this life-saving health care, then we are going to say to the beneficiaries of those tax cuts that you're going to have to pony up and fill this hole that's created in our budget. So I appreciate the support, Mr. Chair, and look forward to conversation about 2591. Thank you.
All right. Thank you, Chair Gomez. We do have a number of testifiers on this bill. As a result, we're going to ask testifiers to keep their remarks to 2 minutes. And the first one, we've got a testifier from SEIU Healthcare. If you could make your way to the testifier table.
Morning.
Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Hello, my name is Simone Blaylock. Hello, Chair Norris and Chair Gomez and the members of the committee. Again, my name is Simone Blaylock. I'm from SEIU Healthcare, Minnesota and Iowa. We represent 55,000 healthcare workers here. And our work depends on Medicaid to support this bill. If the federal government cuts Medicaid funding, Minnesota must fill the gap. So I've been a home care worker for 18 years to my son, Xavier. He has a genetic disorder, intellectual disability, and he's on the autism spectrum. Every day I take care of Xavier. I get up with him, I dress him and get him ready for school and help him with his daily cares. Every day I'm in contact with his teachers and making medical appointments and taking him to those appointments around the community. I also have to be with Xavier so he stays safe. All this is because of Medicaid that I'm able to do this. I have gotten Medicaid for myself also. I have multiple health issues, diabetes and high blood pressure and even a brain tumor. If my health care is cut, I would not be able to care for my son without Medicaid. Hospitals, both rural and urban, will also struggle to remain open. Medicaid provides care for our grandparents and the elderly who stay in these homes. Without Medicaid, Minnesota nursing homes will close. I am fighting hard to stop the federal cuts to Medicaid. I know many of you in both parties are trying to stop them too. Funding for these state programs, especially home care and nursing homes, has always had strong bipartisan support in Minnesota. So if we don't win in DC, Minnesota will still be a rich state. We can't afford to raise the money we need to take care of our people. So Medicaid is a lifeline for me, my family, and the people I care for. So please support this bill. Thank you.
Thank you, Simone Blaylock. Next up is Marika DeCure from MAPE. Please. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Thank you. My name is Marika DeCure. Excellent job on the pronunciation there.
Thank you.
Thank you, Co-Chairs Gomez and Davids, and members of the committee. I am an epidemiologist at the Minnesota Department of Health, but I'm testifying today in my capacity as a proud member of the Minnesota Association of Professional Employees, my union. Thank you for allowing me to voice my support for House File 2591. House File 2591, also known as the Protect Medicaid and Not Millionaires Act, is a step in the right direction in preparing our state to weather anticipated cuts to Medicaid funding from the federal government. The legislation's proposed fifth-tier tax bracket for Minnesotans' largest earners is a reasonable approach to ensure that Minnesotans can continue to rely on the programs and services that they need. Cuts to the state's public health infrastructure have already started. I think we all know that $226 million was cut from MDH last week and has resulted in around 170 or more layoffs or terminations of many full-time employees, contract employees, and part-time employees. These people are experts in their field, and many of them work in areas of infectious disease prevention and control. Minnesotans now face risks to their health and well-being of their communities. If Medicaid is also cut, the impact on health will be irreversible. I would say that we are already in a place where the impact is irreversible. I work as a foodborne disease epidemiologist. I track and investigate outbreaks of illness due to pathogens like Salmonella and E. coli, and my team lost 5 members in the last week. These are global experts who have provided trainings around the world, across the US, to improve foodborne disease outbreak investigations, and we're losing their expertise for no reason. Between the cuts at the state and the CDC and FDA in the last week, we are no longer able to investigate the way that we used to and the way that we should be able to protect the state. We've also lost the entire team, basically, that does data modernization and improves the methods that we have for reporting diseases and blood lead levels. These are just some of the losses that we have had in the last week, and all of these will actively harm the programs that we do and all of the people who we are trying to keep safe and healthy in the state. So we ask you not only to pass House File 2591, but to strongly consider additional revenue increases to begin backfilling the current and anticipated cuts to our public health and safety net programs, as this is likely only the beginning. Again, thank you for the opportunity to testify today.
Thank you, Marika DeCure, for sharing your testimony. Next up is Barbara Bennett. And after that will be Sarah Mullins. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
My name is Barbara Bennett. I am a leader in Isaiah. I attend the Refuge Church in St. Paul, and I live in St. Paul. I have 4 kids and 6 grandkids. I am passionate about them, and it fuels my support for the 5th tax tier and the need for more ways to increase our state's revenue. Years of disinvestment in our communities because corporations and the very wealthy have failed to pay what they should in taxes have hurt me and my kids. When I was raising my daughter Ebony, I did everything I could to help her find her way in life and addressed her literacy and emotional issues. I tried to reach out to many people and organizations to get help that she needed. Sadly, the help just wasn't there. Unfortunately, my daughter dropped out of school and in the 6th grade. She ended up being on the street, selling drugs, getting into gangs, and got caught up in teen pregnancy. I'm not alone in my story. In the apartment building I lived in, I had a neighbor who was a single mother with 8 boys. She was struggling too and couldn't keep up. Now there are some lies being told about single mothers, that all of us don't care about our kids, or that we aren't active in our kids' lives, that we are a drain to the system. That's not true. I was a proactive parent and did everything I could to help my children. Yet the funding needed to have accessible and affordable extracurricular activities, mentorship, emotional support, and culturally relevant ways to empower and develop our children of color in much less now than was decades ago. I've been hearing that even places like Edina are struggling to offer youth programming. Decades of disinvestment has a real impact on people's lives. The consequences of our failure to make sure the wealthy and big corporations pay their fair share shouldn't fall on the backs of my kids, our kids. We must do better. Please support this bill and encourage you to look for ways to raise revenue in other places. Thank you.
Thank you, Barbara Bennett. Next up is Sarah Mullins, and following Sarah Mullins will be Eric Bernstein. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Good morning. Thank you, Chair, for the opportunity, and committee members for the opportunity to testify in this bill. My name is Sarah Mullins. I live in St. Paul. No matter our race, zip code, or income level, Minnesotans rely on our state and federal tax revenues to bolster public goods. Repairing our roads after winter, providing programming for youth, and protection of our lakes and rivers are just a few examples of this ongoing commitment to the general well-being of Minnesotans. I support the progressive income tax structure that funds these and multitudes of other state-administered programs. It's an investment in our residents and our shared future. Medicaid programs make medical care accessible to every Minnesotan. Medicaid enrollment is evenly distributed around every part of the state. It pays for prenatal care, births, and well kid visits, seniors in long care facilities, mental health services for our veterans. It keeps medical care facilities open in rural areas, which means medical care for everyone in those communities. Minnesota does amazing things with Medicaid. On a personal note, my sister is disabled and uses Medicaid. Reliable access to healthcare services is part of what makes it possible for her to work part-time and live independently. I am worried that she will lose her coverage. What happens to her well-being if she stops getting the care she needs? I can't solve this problem on my own, and I don't get to add an adult sibling to my healthcare plan. These expected federal cuts to Medicaid are horrendous. I've called my federal rep and both my senators to share my concerns. I wrote to Majority Whip Emmer, imploring him to listen to the concerns expressed by Minnesota GOP state legislators about these impacts. Every legislator here has constituents who would face harm if they lose access to Medicaid programs. And so today, we must do something together for the welfare of all Minnesotans. And I'm asking you to support this fifth-tier income tax bracket to offset federal Medicaid cuts. Thank you.
Thank you, Sarah Mullins. Next up is Eric Bernstein, followed by Pahua Yang. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Chair Norris and members of the committee, my name is Eric Bernstein. I'm the director of We Make Minnesota. We're a coalition of labor and grassroots organizations united in support of public investment for a more just and equitable state. I want to thank you for the opportunity to share our perspective on HF 2591, which would establish a new income tax bracket on millionaires sufficient to make up the revenue necessary to hold Medicaid harmless in the event of federal cuts. Our coalition is deeply concerned about these impacts, and we are grateful for this conversation about how the state can compensate for lost federal funding. As the federal government continues to pursue reckless and unsustainable fiscal policies, Minnesota will have to decide what role it will play in maintaining vital public health programs like medical assistance. As legislators, you have a great many tools at your disposal to protect these programs, and millions of Minnesotans are depending on your willingness to do so. Often conversations in tax committees center on state-to-state comparisons over tax rates and exemptions and other policies. I understand these concerns around competitiveness, but the current federal outlook, I think, necessitates a different orientation. We have to consider the total level of investment or divestment that we're willing to tolerate. The U.S. already has the weakest social safety net in the developed world, and we have not seen Medicaid cuts on this scale being discussed in several decades. This week, we already heard, as we heard today, of the layoffs of 176 public health staff, including epidemiologists and infectious disease specialists at the Department of Health. So we have to face, we have to ask ourselves what reality we're willing to accept. Infectious diseases did not respond to estimated income tax elasticities, the statistics about business investment and things like that. These are very real realities that are going to face single mothers, families with children. So when we're in tax committee talking about funding these programs, the competitiveness, it can't be the only consideration. We have to think about what public health outcomes we're willing to accept. We should also remember where we are historically. In recent years, total effective federal tax rates have hit their lowest levels since 1979. In 2017, the Tax Cuts and Jobs Act slashed the top marginal income tax rate by 2.6% and cut the federal rate by nearly half. We can choose a different path. And I think this is one idea, but I encourage everyone to start thinking about other ideas of how we can plug the holes that we're going to see in our budget and our essential programs. If there's one critique of this bill, I just say that when I was growing up, a millionaire was someone who had $1 million, not someone who made $1 million in a single year. So I think this is even more progressive than that. So, for a broader base, maybe we consider people who are making merely $500,000 a year, and we raise more revenue that way. Thanks very much.
Thank you, Eric Bernstein. Pahua Yang is next on the list. Welcome to the committee. Please introduce yourself for the record and proceed with your testimony.
Yes, good morning, Mr. Chair, members of the committee. My name is Pahua Yang, and I'm here to testify in support of House File 2591. I am the Vice President of Community Mental Health and Wellness at the Wilder Foundation, where we have been providing mental health services for over 100 years. We are a certified community behavioral health clinic providing integrated mental health and substance use disorder services in the heart of St. Paul. We serve over 2,600 families annually in our mental health clinic, and we have full-time therapists in 24 public schools, 4 large charters, and 1 intermediate school district, where we serve almost 600 children and families every year. We have 200 dedicated team members who work together on a daily basis to support individuals and families in obtaining and maintaining recovery. The majority of the people we serve either have Medicaid as their primary or secondary coverage. Most are employed in contributing back to our community. I make that clarification because when I talk about folks on Medicaid, people often make a lot of assumptions about who they are. We're talking about our friends, our neighbors, our brothers and sisters, our parents, grandparents, classmates, folks who are doing their best and seeking treatment because they want to give themselves and their families a better life. Cutting Medicaid would be cutting our community off at the knees at a time when they are most vulnerable. For many of the adults and families and little kids that we serve, an underfunded Medicaid system could literally mean life or death. My first client when I came to Wilder 16 years ago was a 5-year-old who tried to kill himself because he had lost a beloved family member, and his 5-year-old heart just couldn't absorb that pain. His family was on Medicaid. His parents had multiple jobs and worked more than 40 hours a week. These are the faces of Medicaid. The loss of Medicaid, which is one of the main funding sources for many of the community mental health clinics across Minnesota, would not only decimate our clinics and our fragile mental health system, it would derail all of the gains we have made in this state to grow our workforce and force us to dismantle the system we have proudly been building for all Minnesotans. 1 in 5 Minnesotans relies on Medicaid. That means most of us know someone whose life or livelihood depends on Medicaid. And I do not exaggerate when I say the loss of Medicaid could be the difference between life and death for many Minnesotans. It would mean that more clinics and hospitals and nursing homes will not be able to keep their doors open for those who depend on them for services and employment. My colleagues at Wilder Research, who work throughout the state, have pointed out that rural communities are in particular danger. Not only do they have many folks on Medicaid, as demonstrated by the coverage maps that we've provided, but as clinics shut down due to the loss of steady MA reimbursements, it will become even more difficult for folks to access health care close to home. It would dismantle the community mental health system we have been building with your leadership. Over the years, I've sat in front of many of you and asked you to make investments in us, in Minnesotans who deserve great care and great jobs in the mental health field. Today, I ask you to rise to the occasion once again. We desperately need your leadership to help us guard against the gutting of Medicaid. We have to prepare for the losses for funding we know are coming, and I ask you to please not sit idly by. This bill provides the state a way to mitigate some of the pain that is headed our way. So please come together and act by passing this bill. This is not just a healthcare issue. This will impact every corner of the state and every jurisdiction, and it will decimate a healthcare sector which employs so many Minnesotans as well. Medicaid touches every community in this state, and what has made Minnesota special is that we take care of each other. Thank you so much, Mr. Chair, members of the committee.
Thank you, Pahua Yang. Any other members of the public who wish to testify on this bill? All right, seeing none, we'll move on to member discussion.
I have a bill.
Representative Anderson.
Thank you. Is Human Services here, the Medicaid unit?
I did see them earlier. I don't know if they're here. Are you looking for one of them to come up to the testifier table, or? Yeah, Chris.
Come on.
Yeah. All right,
Thank
please proceed, Representative Anderson.
I have a couple questions. So Medicaid's been opened in Minnesota. We're one of 7 states that provides Medicaid to undocumented or illegal immigrants. Do you know how much of those Medicaid dollars are federal versus state? It looks like generally, from the numbers that I can find, the federal dollars is over half, about 60% of the overall Medicaid dollars spent in Minnesota. Is it the same percentage with undocumented?
Welcome to the Taxes Committee. Please introduce yourself for the record and proceed with answering the question.
Thank you, Mr. Chair. My name is Christy Grom, and I'm with the Department of Human Services. Representative, we can get back to you with all of the specific data that you're requesting. I believe that you're either referring to emergency medical assistance, which, no, you're referring to Minnesota Care, which does not have a federal match.
Representative Anderson.
Thank you. So both. So, emergency has been open the whole time, and then Minnesota Care, my understanding is that Medicaid sign-up starting in '23 and then now in '25 to illegal undocumented immigrants, that Medicaid is available in Minnesota right now.
Ms. Grom.
So,
Mr. Chair, Representative Anderson, I believe you're referring to Minnesota Care, not Medicaid, which generally does have some funding implications from the behavioral health plan, the state's basic health plan, but generally it doesn't have the same kind of match that Medicaid does, which is about a 50 to 90% from the federal government.
okay.
Representative Anderson.
Thank you. I'd like those numbers because my understanding is that that was opened as of '25 in the last tax bill or human services bill, last session, I think, to undocumented illegal immigrants. Medicaid was in Minnesota. But it would be good to know.
No, Medicaid,
Okay.
Chair Gomez.
I mean, Medicaid's is a federal program that is not, that is available to citizens, is my understanding, or people with legal status.
Yes,
Ms. Grom.
Mr. Chair, Representative Chair Gomez is correct. You are referring to Minnesota Care, not.
Okay. Thank you. I'm not
Representative Anderson.
I'm not a human services expert, so I would like those numbers. I think that's important for the committee, just to understand how much of those dollars are flowing, Medicaid dollars flowing to, whether that is, into any of these programs. But they're, how much Medicaid dollars flowing to illegal immigrants. And I know we're one of 7 states that has allowed that through Minnesota Care.
Chair Gomez.
Mr. Chair, I just want to be really clear. That's the premise of your question is, Ms. Grom just said, Medicaid dollars do not go to provide health care to undocumented people. But what I do want to say is that there is, hospitals have to provide care to people. When people don't have preventative health care, when they can't go to a regular doctor, where do they go and receive their health care? They go to our hospitals, okay? In the metro area, our hospitals are, especially our kind of public safety net hospitals, do have challenges around uncompensated care, certainly not just for people who are undocumented. But the issue of uncompensated care that hospitals must and do provide to people when they're experiencing medical emergencies is a huge issue, especially for rural hospitals. And so we all, you don't have to be a healthcare expert. You just have to have been paying attention to the world to know that a pound of, or an ounce of prevention is worth a pound of cure. And so whatever you want to say about your personal views about immigration, immigrants are in every county and every corner of this state. They are working side by side with us. Their children are going to school side by side with our children. And providing medical care is a way to ensure that our medical system, especially in greater Minnesota, is not, kind of paying for the most expensive way to provide care to people.
Representative Anderson.
Thank you. I'd love the data because I know that you said a portion of Minnesota Care goes to undocumented, and so that we are providing dollars for that. So I would love that data. I also have a question, I guess, about the bill. So if the in here it doesn't really specify why cuts would occur. This is the overall percentage is about a 13% cut if it happens. If the $880 billion is cut at the federal level, it's about a 13% cut from the numbers that you gave me overall to Minnesota's Medicaid match, I guess, which would be overall about a 7% cut in funding here, which, but I would, we know that here alone, the Attorney General has prosecuted, from what I could just find quickly, $70 million in Medicaid fraud cases. The Attorney General, good job. That's probably a drop in the bucket. We know that. It's probably a tiny bit amount. We have looked at numbers between the dollars which are going to illegal immigrants, which is illegal and fraudulent, okay? And
Mr. Chair.
And the dollar, it's illegal.
Mr.
And-
Chair.
Chair Gomez.
Yeah, thank you. We're just gonna, we're gonna stay within this bill, and we're not gonna refer to people as illegal.
They're illegal.
No human being is illegal. Human beings are human beings. You want to try to dehumanize people, and you want to try to create division when there is no need for that.
All right, Representative Anderson, we are going to try to bring it back to this specific bill. If you have questions or comments about this specific bill,
Thank you.
please.
Just the final. We know that there is significant fraud in Medicaid. We know that. And I hope, as you know, I'm more of a deficit hawk than a tax hawk. And we have to they're trying to do something at the federal level to balance the budget. What they do beyond that, we'll see what happens. But they have to do something to get rid of the fraud at the federal level. Just like we have to do something to get rid of the fraud at the state of Minnesota level. And it's a huge, huge amount of money that's fraudulent in the state. Tax dollars that aren't going to the people that need it, that aren't going to the nursing homes. The governor's budget has nursing home cuts. And so the question is, if the feds cut the fraud, and they cut those dollars because of changes in policy about Medicaid dollars going to they tighten up the fraud, does that create a cut in your proposal? Are you proposing that we backfill fraud in Medicaid by raising taxes at the state level? That's my question.
It does sound like there was a question at
Oh,
the tail
I-
end of that
sure there
statement.
was.
Chair Gomez.
Yeah, please show me anything. Show me anyone who thinks there's $880 billion of fraud in Medicaid. Please, by all means. You just talked about $70 million that the Attorney General's Medicaid fraud unit has covered. I don't know how many years that's over. And listen, 4 years. Okay, so how does that compare to $1.2 to $1.7 billion a year that we might be facing if they implement these cuts? Those are not comparable numbers. And like I said, 42% of children, Representative Anderson, are on Medicaid. That's where they get their health care from. They're not committing fraud. I agree. I actually agree with you. And I've I know that you're on Chair Robbins. She's not here, but you're on her committee, and you've talked about, what it means that we have basically privatized so much of government by outsourcing it to nonprofits. We have to have a real conversation about that. And honestly, I wish that was the conversation that was happening in Chair Robbins's committee. I wish she was talking about, and again, and this is providers we're talking about. This is not individuals. This is not the pregnant woman getting coverage, or the 42% of Minnesota kids who are committing Medicaid fraud. These are unscrupulous companies, right, run by fraudsters.
Yep.
And we absolutely agree. Any cent of money that's supposed to go to an elder or a disabled person or a kid in Minnesota that's being siphoned off to be spent on luxury goods is an offense, and we should link arms and root it out. And I wish that was what was happening in the fraud committee, but instead we're talking about honestly, relatively small bore grant requirements that are going to little nonprofits. Profits. It's like, let's actually look at the flaws in the delivery system for healthcare in our country. We can do that together. But the idea that you talk about, oh, well, we have to do something about the federal debt. That's what you just said. This House budget resolution, $4.2 trillion in tax cuts, they're not paying for those. They're adding more than $2 trillion to the national debt just with this budget resolution. Again, you're going to hear a lot of people talk about, oh, well, the reason that we're doing all of these draconian cuts is to balance the national debt. Well, you can say that, but it's in black and white in the budget resolution. That is not the plan. The plan and the reason for House File 2591 is because they want to give their buddies $4.5 trillion of tax cuts on the backs of people on Medicaid and people on SNAP. And in Minnesota, we're not going to allow it. We're going to have a response. We're going to ask those very same millionaires and big companies that are benefiting from, they had a 40% corporate rate cut in 2017, and they're going to give them another one. Highest income Americans disproportionately getting this $4.5 trillion. The budget lab at Yale University did this analysis based on this budget resolution and said that this would be one of the largest if this budget resolution from the House goes into place, it'll be one of the largest transfers of wealth from the bottom to the top in U.S. history. So let's be very clear about what the intent is here. Nobody's proposing to gut Medicaid to pay down the national debt or to make sure that waste, fraud, and abuse is rooted out. That is an excuse, but what is actually happening is here in front of us in black and white.
Thank you, Chair Gomez. We've got a number of members on the list here, so in fairness to the rest of the committee, we are going to move on. Representative Lee, I saw your hand go up a bit ago. Do you still wish to get in, or?
I mean, I don't have to. It seems like it was very sufficient.
Yeah, the floor is yours if you'd like. We went through a lot of twists and turns since you raised your hand, and so I
would
didn't know if you.
Yeah, I can just summarize and say that, the scale of what we're looking at coming down from the federal government is huge. And the only way to solve this is to look at revenue raisers. And so I really appreciate Chair Gomez's, I guess, innovative idea of using this pay for to really make sure that we take care of our most vulnerable people across the state. So thanks.
Thank you, Representative Lee. Representative Johnson.
Thank you. Thank you, Chair. Thank you, Chair Gomez. Question I just have, is there another example, is there another state that has a fifth tier that just floats up and down yearly?
Representative Gomez.
Thank you, Mr. Chair. I'm not sure. I know some things about other state tax codes, but don't know them well enough to answer your question.
Okay.
I would say that we are in absolutely unprecedented times with what we're facing from the federal government, and so sometimes those call for unprecedented measures. And Sean's pointing me toward my brief, maybe it's.
Thank you. Thank you.
Representative Johnson. Representative Johnson.
Thank you. Thank you, Chair. The two other questions I have is I noticed this got brought up before in a previous bill that I had before me regarding what ifs. And I see here it says by December 31st, the Commissioner of Management budget would have to have certified the estimated total loss. What if that number doesn't come to us until February, January, March, like we're, the example we're dealing with right now as far as cuts? What would happen in that situation?
Chair Gomez.
I guess I would ask if I could get an assist from nonpartisan staff. I'll look at.
Mr. Williams.
Chair Norris and Representative Johnson, so the Commissioner of Management and Budget would be required to make that certification by the end of this year. And then the Commissioner of Revenue would then apply the rate beginning for tax year 2026, so that's returns filed in 2027. So if there's no federal changes sort of in place by the end of this year, then presumably this rate increase would not blink on. So it's sort of dependent upon what's happening as of the end of this calendar year that would then go into effect for next taxable year, so the returns filed the following year. Does that make sense?
Representative Johnson.
Sure, thank you. So in a situation where if this was in place in 2024, we didn't know what was happening, December of 2024, he would have said, we don't need anything, and all of a sudden in March, it decided we needed 800 billion. What would happen in that situation?
Mr. Williams.
Chair Norris and Representative Johnson, my understanding is that the calculation of this fifth tier rate would be based upon the amount certified by MMB to the Commissioner of Revenue at the end of this year. So if there's no federal policy changes reducing Medicaid revenues to the state, then no fifth tier would go into effect next year.
Okay, so
Representative Johnson.
the only one last thing, Mr. Chair, my concern is going back, what message does this give to the federal government that Minnesota just told us they don't need us and they'll just keep raising their taxes and don't need to look for us for any help?
Chair Gomez.
I mean, Representative Johnson, I guess I don't know how the federal government's going to interpret this bill, or if they're going to take it as an indication that we don't need them. Across our budget, we have billions of dollars that flow to Minnesota. It's not just Medicaid. There was $23.3 billion of federal funds budgeted in fiscal year 2025 in our state. We do not have the resources to make up for $23.5 billion. Hey, I mean, if they're paying really close attention to a bill in the tax bill in the Minnesota House, then that's interesting, and it'll be interesting to watch the federal reaction to House File 2591, but I don't know. I think you think we're a bigger deal than we are, maybe. I'm not sure.
Yeah.
Thank you. Thank you, Chair.
Thank you. All right, Representative Elkins.
Thank you, Mr. Chair. Just a quick comment. I serve with Representative Anderson on the Fraud Prevention Committee, where we have been spending a lot of time on this. And what we know already is that the vast majority of the fraud is perpetrated by fraudulent providers, not the patients who are in danger of losing their care as a result of these federal actions. And we also know already that there is no magic wand that we can wave to immediately make this go away, and that in fact it is going to require a significant investment in modernizing DHS's computer systems to be able to make significant improvements on how much and how quickly we can ferret out and prevent this fraud. Thank you.
Thank you, Representative Elkins. Representative Weiner.
Thank you, Mr. Chair. My thoughts with this bill is the kind of the law of unintended consequences. And we've seen this, it goes back a long ways, tax the rich mantra, and what ends up happening. It goes back to the Middle Ages. There was something where you were taxed by the amount of windows that you had in your building or your house. We're going to tax the rich by doing this. And what ended up happening was they simply boarded up their windows, blocked them up, and the tax burden ends up falling on the lower income, the people who couldn't afford to do that or couldn't board up their own windows. We saw this in another bill. It was on the East Coast where to tax the rich, the idea was to tax expensive yachts. What happened was the rich simply bought their yachts someplace else, and it decimated the yacht building industry in that area. In our own country, in the 1930s, the income tax was a tax the rich to get us out of the Great Depression. And the tax burden ended up falling onto the middle class. So in our state, and especially if this bill moves forward, the unintended consequence there again is the people who have the ability simply will move. And then the tax burden will end up falling on the people that we don't want it to fall on. So every time we have a bill like this, we have to look at those intended consequences and the unintended consequences and really weigh them out. Because although something sounds good on the surface, the tax burden keeps falling on the same people, and that's the middle class. And that's why I'm really concerned about this bill. We simply will see people using their feet that can, and they'll move out of our state and end up having more problems than the intention was to fix. So, thank you, Mr. Chair.
Thank you, Representative Weiner. Speaking of unintended consequences, I'm pretty sure Mr. Bernstein just added the window tax to his list of ideas. To close us out, Chair Davids.
Thank you, Chair Norris. And getting back to the bill itself, I actually read it, and I was looking for the fifth tier, and I see on 1.11, there's the first tier, then the second tier, third tier, fourth tier, and I couldn't find the percentage for the fifth tier. So it says go to G. So if we go to page 3, line 3, is it John 3:16? No, it's 3:16. It's 3:16, and you go there, and there's no limit. Members, I don't know if anybody in this room has been on the floor when we've had debates on ... where you just put ... In other words, you don't have a number in there. This is a ... There's no number. Now, I've heard things, I'm not sure why we spend so much time on the federal government. Maybe it's good we do, I don't know. But I've heard expected cuts, maybe, could be, would have, should have, could have. And I was always taught that if ifs and buts were candy nuts, we'd all have a Merry Christmas. Chair Gomez, I give it to you for creativity. This is amazing. This is amazing creativity here. But to go to starting in 3:16 with the ... where there's no number, I don't know how you manage that. And Sean Williams did a great job of explaining how it would work. But members, we actually have some bills on the agenda today that could become law and could do some good things for people. This is going nowhere. So I'm going to say, and finally, my favorite words in the legislature when a legislator says, and finally. And finally, I'm done. Thank you, Mr. Chairman.
Thank you, Chair Davids. Closing comments, Chair Gomez.
Yeah, thank you, Chair Norris. Thanks for the good conversation today. I just want to say that there isn't, you know, Representative Wiener and I can probably go back and forth about the scholarship around tax flight. It's not, certainly not settled that, you know, that people are responsive to, you know, increases in taxes like this, and that is like the main thing that causes migration. There's a lot of conversation about that. A contingent rate on people making above $1.6 million if they're married filing jointly, that's $1.6 million of income in a year, is not something, there is no mechanism in here where this can fall in the middle class. It's just not the case. But I just want to say I appreciate the conversation. We have to really, people can say whatever they want, right? People can make whatever, especially politicians. Politicians can say whatever they want. We got to look at when it comes down, when you have something in black and white, like this U.S. House budget resolution, you have to take people at not at their word, but when you have like something that's adopted and that's in black and white, you have to take it for what it says. And it's very clear that what the plan is at the federal government, the plan there is to gut Medicaid, to gut SNAP, and to do so, again, not to balance the national debt, not to achieve other policy goals that help people afford their lives, right? Which was like the promise of this administration. And what have we seen so far? Nothing even vaguely in that realm. Yesterday, $6 billion in new taxes in the form of tariffs, but I heard an administration official describe it as $6 billion of taxes just yesterday on the news. It was an interesting moment of clarity. And they want to gut Medicaid and gut SNAP to give tax breaks to their friends. And if that is the plan, then we have to have a plan in Minnesota. And this is one attempt. I'm open to other solutions to plugging a $1.4 to $1.7 billion annual hole. Please bring me all of your ideas. Thank you, Mr. Chair.
Thank you, Chair Gomez. And with that, Chair Gomez renews her motion that House File 2591 be laid over for possible inclusion in the 2025 taxes bill. The bill is laid over.